See, in the last class we have discussed antidepressants, and this class will be anti-manic drugs. So only a brief 15-minute session I'll be taking, and then there'll be a self-directed learning session. आगे आ जाओ. Okay, so we discussed this question. Now there is a loop in this question, that there is a withdrawal symptoms due to discontinuation of the drug. This withdrawal symptom is not due to longer acting drug, which is causing, like beta blockers, which on withdrawal, when you're giving for a long term, beta blockers, if you suddenly withdraw, there will be a withdrawal symptoms. Okay, now these withdrawal symptoms was due to sensitization of certain receptors. Now this is not due to sensitization of certain receptors. They were just asking the discontinuation symptoms. Due to discontinue the drug, again the symptoms of depression will be there. Okay, effect of the drug is inhibited. So they are just asking the inhibition effect of the drug. So which one will be having discontinuation effect? The drug which is short acting. So which one will be the one which is minimum risk? The longer acting drug. So in this the answer is fluoxetine. So I want to correct it. The answer is fluoxetine, because this is a longer acting drug with a long acting metabolite in it. So this is the answer is fluoxetine, not fluvoxamine. All these drugs, they may cause discontinuation symptoms because of short action. Now we're coming to anti-manic drugs or the mood stabilizers. So we just compare how the mania is different from depression. So mania is usually seen before the onset is before the age of 30. Now this is not there with depression, can be at any age, but usually mania is seen, the onset is before the age of 30, and the mood is over here, it's remain elevated, wear expensive clothing, he is irritable in nature, speech is loud and rapid, running, rhyming, changing vulgar, using vulgar language, weight loss, grandiosity, delusions, distracted, hyperactivity, increased need for or decreased need for sleep, inappropriate or flight of ideas are there. So these are all the symptoms of a mania as compared to a depression. Now in bipolar disorder, this cycle of mania or depression, it continues in episodes. So at the end you should be able to classify these anti-manic drugs and describe lithium. So only one drug will be mainly focusing on, that is lithium. You should be thorough with the mechanism of action, uses, adverse effects, and the drug interaction of lithium. So in anti-manic drugs are also known as the mood stabilizers. Now they are used for anti-manic action, means these drugs will control the mania symptoms, or it can be as mood stabilizers. Okay, now this means that they stabilize the mood and prevent the mood swings in the bipolar disorder. So how it has been classified, the main agent is lithium carbonate. Then you have these alternative agents like valproate, carbamazepine, and atypical antipsychotics. ठीक है, इतनी सी classification in anti-manic drugs. You have lithium is carbonate, then alternative drugs you have valproate, carbamazepine, and atypical antipsychotics. Now lithium is a monovalent cation just like your sodium. ठीक है, सोडियम की तरह एक मोनोवेलेंट cation होता है. Now important mechanism जब lithium का पूछेंगे, so what you have to answer is, now there is hyperactivity, there is increase in this excitatory neurotransmitter activity. कौन से neurotransmitter की activity increase हो रही है? Acetylcholine, excitatory neurotransmitter activity. Norepinephrine. stop this side, concentrate. So this is norepinephrine, basically the excitatory neurotransmitter activity. There is hyperactivity of this neurotransmitter. और उसमें क्या देखा है, dopamine is also there. Now what is seen here is there is this excitatory neurotransmitter will act on the G protein coupled receptors and they will increase the IP3 DAG activity. So this is the, what is IP3 DAG? Second messenger. तो इसकी activity increase दिखती है. Can you switch off your phones? So this IP3 DAG activity is increased. Now what does lithium do is, it inhibits the synthesis of phosphoinositol diphosphate. जो ये बन रहा है, अगर ये नहीं मिलेगा तो IP3 DAG नहीं बनेगा. ठीक है, तो इसके लिए क्या कर रहा है लिथियम? लिथियम इज इनहिबिटिंग inositol monophosphate, which is helping in synthesizing of inositol diphosphate or phosphatase. So it's finally causing the depletion, and the level of the second messenger IP3 DAG will be decreased, and this decrease in the effect of the neurotransmitter on the postsynaptic neuronal membrane. So this is the mechanism, main mechanism of action of lithium. By inhibiting inositol monophosphate, it inhibits the synthesis of phosphoinositol diphosphate and thus generation of IP3 DAG pathway. Now what are the other mechanism? लिथियम सोडियम की तरह काम करता है, लेकिन जैसे सोडियम कहाँ ज़्यादा होता है, बाहर या अंदर? बाहर ज़्यादा है, लेकिन ये इक्वली डिस्ट्रीब्यूटेड रहता है अंदर और बाहर सेल के, और therefore there is no change in or the exchange of ion occurs in between the cell membrane. So this also inhibits the noradrenaline and dopamine turnover, inhibits the noradrenaline sensitive adenyl cyclase enzyme and uncoupling of receptors from their G protein. It also affects the protein kinase C. So these are the second messengers and the enzymes which are involved in the activity of these neurotransmitters. These are all being inhibited when you are giving the lithium, and it causes mood stabilization. So it has a selective, always remember lithium का normal patients पे कोई role नहीं है. It has an effect only on the overactive neurons. So it has an anti-manic effect in mania and mood stabilization effect in bipolar disorder. There is no noticeable effect in normal individuals. And what are the other effects it has? It inhibits the ADH action. ADH का action क्या होता है? Water absorption. ठीक है, तो क्या होगा अगर ADH का action नहीं होगा तो? Diabetes insipidus like state. So lithium causes diabetes insipidus like state. It also increases the leukocytes. So it causes leukocytosis. It causes hypothyroidism. ठीक है, hypothyroidism, leukocytosis, and it has an insulin-like action on glucose metabolism. It has an insulin-like action. So these are the other effects of lithium. So when we talk about the pharmacokinetic, its absorption complete in 6 to 8 hours, peak plasma level attain कर लेता है within 2 hours. Distribution is again smooth, and it crosses the placenta and secreted in milk also, so you have to be careful. It may cause abstin anomaly if it is given in pregnant women, pregnant and lactating women, and thus contraindicated in pregnant and lactating women. It has no metabolism. It is excreted as such through the kidney. So अगर liver parameters compromised भी हैं, you can give this lithium. Lithium has no role in the liver function. It is not affected, excretion is not affected. But kidney function test has to be done before giving lithium. So you have to see the creatinine clearance, because otherwise this lithium excretion can be affected if you are not seeing the kidney function. तो और क्या चीजें आपको देखनी है, ये भी वैसे अगर सॉल्ट कम देंगे तो जैसे सॉल्ट ज्यादा एब्जॉर्ब होता है वैसे ही अगर सॉल्ट कम है तो लिथियम विल आल्सो बी एब्जॉर्ब्ड मोर. ठीक है, तो अगर सॉल्ट कम है तो देन इट विल बी excretion will, if there is a increased salt intake, excretion will increase. If there is low salt intake, excretion will decrease. Diuretics and NaCIs will also increase the retention of lithium. NaCIs, diuretics, except this mannitol and all, the other diuretics whichever causing the depletion of sodium, they will causes the lithium retention and may cause lithium toxicity. ठीक है, तो ये बहुत इंपॉर्टेंट है. ड्रग इंटरेक्शन की जब हम बात करेंगे तो NaCIs, डायरेटिक्स एंड लो सॉल्ट इनटेक यू हैव टू टेक केयर कि lithium toxicity can occur with this. So you have to see the blood counts, electrolytes, pregnancy test, thyroid function test, but you don't require the liver function test. Now what is the clinical use? In acute mania, you have to give for immediate relief valproate or atypical antipsychotics. Valproate is a good drug for rapid cyclers. ठीक है, जिसमें fast more than 4 cycles if you see, they are known as rapid cyclers, and in this you are preferring to give valproate. With or without benzodiazepines, this is the treatment for acute treatment of mania, and relief of symptoms will be done by giving valproate, atypical antipsychotics with or without benzodiazepine. Now after episode is under control, you can give lithium for 6 to 12 months. उसका immediate effect नहीं है lithium का. It has a lag time of 2 to 3 weeks is there with lithium for its effect to come. So when the episode is controlled, it has to be continued till 6 to 12 months. Then another is, it is used in prophylaxis of bipolar disorder. How much you have to maintain? थेराप्यूटिक मॉनिटरिंग की जब बात करेंगे तो लिथियम का नाम सबसे पहले आता है. इट नीड्स अ थेराप्यूटिक मॉनिटरिंग, सो द डोज इज 0.5 to 0.8 मिली इक्विवेलेंट्स पर लीटर. दैट इज द मेंटेनेंस डोज. ठीक है, सो दैट हैज टू बी मेंटेन. इट शुड नॉट इंक्रीज मोर देन 1.5 मिली इक्विवेलेंट्स पर लीटर. And you can have to give this therapy based on what is the type of bipolar disorder it is, cycle length, comorbid condition के associated हैं, and what are the concurrent medication are going with in the patient. Because slight variation in the concentration of the plasma can lead to lithium toxicity. It is gradually introduced and gradually withdrawn. Another use is recurrent neuropsychiatric illness, cluster headache, and as an adjuvant to antidepressant in resistant non-bipolar major depression. So what is the role of lithium in depression? Lithium inhibits the brain-derived neurotropic factor degradation. Glycogen synthase kinase 3 causes the degradation of the brain-derived neurotropic factor. उसका degradation होने से रोकता है lithium, and that's why it can be used in resistant non-bipolar major depression also. So these are the uses. What are the uses? Roll number 50. Acute mania. To prevent the recurrent manic attacks in mania, then in prophylaxis of bipolar disorder, to stabilize the mood, in recurrent neuropsychiatric illness or cluster headache, and resistant kind of this major depressive disorder also you can use lithium. So क्या doses हम देते हैं? 300 milligram twice a day or thrice a day. So should not exceed from 600 to 1200 milligram per day. से ज़्यादा नहीं exceed करनी चाहिए. So range is 0.6 to 1.4 milliequivalents. इससे ज़्यादा नहीं होना चाहिए plasma concentration. And therefore the monitoring is important and very low therapeutic index, so you have to be careful with lithium. And there could be individual variations, so again for that you need therapeutic drug monitoring with lithium. So what are the adverse effects? So this is a mnemonic to remember the adverse effects of lithium. Leukocytosis, increase in weight and edema, tremors and teratogenesis, hypothyroidism, increased thirst or polydipsia, urine formation increases, that is polyuria. So for this diabetes insipidus, which is the drug of choice? Lithium-induced diabetes insipidus, amiloride is the drug of choice for this lithium-induced diabetes insipidus, and another drug which can be used is thiazides. Though it is a diuretic, but it can be used in lithium-induced diabetes insipidus. From AM, you can remember motor disorders. It may cause incoordination of movements, ataxia, choreoathetosis, dysphagia, hyperactivity, and there is no antidote. Remember that there is no antidote of lithium. So tremors, teratogenesis, there is abstin anomaly, and fetal goiter can occur if you are giving in pregnant women. So it may cause abstin anomaly or fetal goiter. So as it is causing leukocytosis, you can also use in neutropenic-like conditions. So in cancer chemotherapy, when you are giving, if there is a neutropenia, this lithium can be used as therapeutic purpose because it causes leukocytosis. Now what are the important drug interactions? Diuretics and NSAIDs. Then other drugs you have to be careful is tricyclic antidepressants and ACE inhibitors. Okay, again it may cause reaction because again the sodium ACE inhibitors again affect the sodium concentration, and that's why they again you have to be careful when you're giving with ACE inhibitors or tricyclic antidepressant, but the main drugs is NSAIDs and diuretics. Now alternative to lithium is valproate. For use for acute mania and rapid cyclers, you can use this valproate. Divalprox is another congener of valproate which is used. Carbamazepine, it is not much used, but though it can be used in acute mania and also as a prophylaxis in bipolar disorder. Now lamotrigine की special बात ये है कि it can be used in depressive type 2 type of bipolar disorder, जहाँ पे manic phase की जगह depressive phase is more. In that case, lamotrigine is the drug for this type 2 type of bipolar disorder. Then atypical antipsychotics you have, that is again being used. These drugs will take in detail when the chapter which is covering these drugs will be taken. So you have, for the summary, lithium is effective in treatment of the manic phase of bipolar disorder and also in acute mania to prevent the recurrent manic attacks. And you can, anybody like rule number 62, if we see this objective, classify anti-manic drugs. What are the anti-manic drugs? Valproate, carbamazepine and atypical antipsychotics. So remember, these are the anti-manic drugs. Now you can do your self-directed study on this topic. We have some MCQs, and again, so Dr. Ruchi will take these MCQs after you will complete your self-directed learning.